Good morning, everybody. This is Robert. I'm the editor of the website, outbreaknewstoday.com. And as promised, I'm going to go ahead and take on this monumental task of trying to do updates on this super rapidly evolving situation with the novel coronavirus 2019. And things I say right now may be dated by the time I'm done. So things are just happening so fast. And this is to be expected. I'm not terribly surprised, but I do have quite a few things I want to cover in this Facebook Live today. So let me go ahead and get started. And as many of you are probably familiar, the World Health Organization met twice this past week. Their emergency committee trying to determine whether they wanted to declare this a public health emergency of international concern. And I believe that was on Tuesday and then again on Wednesday. And at least for now, they decided that they wouldn't declare this a public health emergency of international concern. I don't know. What are your thoughts about that? Do you think this is at that level, or did the World Health Organization make the right move? Not sure, but clearly it's not out of the realm of possibility that this will happen in the near future. But currently, right now, it has not been declared. Does anybody even know, since 2005, since the emergency committee was set up, formalized, how many times have they declared a public health emergency of international concern? And can you name the 5? Oh, I just gave it away. It's 5, right? Can you name them? I'd love to see the guesses. Of course, in 2009, it was the H1N1 influenza pandemic, or some people call swine flu. That was the first time. Then back in 2014, they did a PHEIC because of a increase in polio cases in several countries. After the global eradication numbers were dropping down, and they declared that back in 2014. And I think earlier this year, they even said that this will continue to remain a PHEIC, a public health emergency of international concern. Then in 2014, in August, they declared the Ebola outbreak in West Africa, a PHEIC. In 2016, do you recall which disease, which outbreak, which epidemic they declared a PHEIC? Well, if you said Zika, that would be correct. And of course, the 5th one was last summer when they declared the Ebola outbreak in the DRC a PHEIC. So that's how many there's been so far. And so far, the novel coronavirus out of Wuhan, China, has not been. Although this thing is spreading pretty rapidly. And again, and the numbers that are out are probably much lower than what's actually out there. So let's go ahead and take a look at some of these numbers. The latest information I got from the Chinese health officials is there's almost 1,300 confirmed cases. The actual number is 1,287. And that's not just in Wuhan anymore. The cases have spread outside of Wuhan into many areas of China. And there's been 41 fatalities. The bulk of those have been in Wuhan, but there are some fatalities outside of Wuhan now. And interestingly, I saw one report where the first case of a healthcare provider has died due to the novel coronavirus. And it was a physician that was working in the province of Hubei, the location where Wuhan is, the city of Wuhan. If we take a look at some of the cases that have left China, right, exported cases, imported into these other countries, what we've seen so far, and this may have changed since I tabulated this list. We have one case in Australia now, 3 in France, 5 in Hong Kong, 2 in Japan, 2 in Macau, 1 in Nepal, 3 in Singapore, 2 in South Korea, 1 in Taiwan, 5 in Thailand, 2 here in the United States, right? We had 1 in Seattle, and then we had 1 yesterday confirmed in Chicago, and 2 in Vietnam. So that's what we know to date. Again, don't hold me to it because that may have changed since I did any kind of prep for this show. And I could speak to what's happening in the U.S. right now. There have been 69 persons under investigation, PUIs, so far that are being tested, and they met the case definition in some way in 22 different states. So this thing is really spreading, and if you look into any kind of a news feed on coronavirus, you can see that places all over the world have suspicious cases or these PUIs. Now in Wuhan and surrounding cities, China has taken some pretty drastic measures, particularly since today is the start of the Chinese New Year, or they call it Spring Festival in some cases. A massively busy travel day for that country. And depending on what you read, I've seen some stories saying there's been 12 cities that have been put on shutdown, and as high as 15 cities. But in total, we're talking about 35 to 40 million people that are on lockdown within their cities. So yeah, that's something it's hard to even imagine. It's hard to imagine, me being in the United States, that they do this to New York or Los Angeles, or even if you go to Europe, if they did this in London or Paris or something like that, it would be very, very hard to imagine. But that is what's going on right now. Thank you, somebody on Facebook, Baptiste, who now says there's 3 in Taiwan. See, it's so rapid. It's so hard to keep up with it. And by the way, I would appreciate it if you would let me know where you're watching from. I always like to know who's interested in these topics and where they are. So go ahead and let me know about that. Now, I have talked to epidemiologists, and a lot of them are not so sold on these travel bans and stuff like that. And there's evidence that they really don't work that well. It's more of a good feeling thing for the population. But we've seen it during the SARS outbreak, right? There was where cities were, shutting down travel and isolating cases and screening at airports and borders, everywhere from Toronto to Beijing, and with not a whole lot of effect. We saw it with the Ebola outbreak in 2014. And there were politicians here in the United States that were calling on, sealing up the borders and all that. So what's going on in China is kind of unprecedented. We haven't seen anything like this before. It's really, really drastic. And, some experts are saying they've never seen attempts to quarantine on this scale. And, many in the epidemiology world say, it'd be a pretty good thing, if there was some real strong evidence that travel bans work, but they don't really appear to be very helpful, according to some experts. Travel restrictions, airport screenings, essentially delay the spread of the disease, but they don't have a lot of impact on how many people actually get sick. And sometimes they can make it harder for, aid people to reach out to communities affected by the disease. And we've seen history of travel bans not working that well. They didn't work really well with the bird flu spread back in 2000, in early 2000s. They didn't work that great with the swine flu in 2009. And they didn't catch a single case during the SARS epidemic back in 2003. So what do you think? Do you think the travel bans and airport screenings, are they of a lot of value? Or is it just something to make the populations feel good? And what do you think about what's going on in China? Would you like that to happen in your city if this was going on? Just curious. Next thing I wanted to touch on is something I saw very, very interesting. A study out of the New England Journal of Medicine, and it's a perspective. It's not a study. It's perspective by some experts, and it's an impact assessment. And what I want to do is just go ahead and read what they had to say. And these are the final paragraphs. So it really pretty much sums it up, but it's enlightening. It says the substantial involvement of nosocomial transmission in both SARS coronavirus and MERS coronavirus outbreaks suggests that such transmission is a serious risk with other newly emerging respiratory coronaviruses. In addition to the vulnerability of healthcare settings to outbreaks of emerging coronaviruses, hospital populations are significantly increased risk for complications from infection. Age and coexisting conditions like diabetes and heart disease are independent predictors of adverse outcome in SARS and MERS. Thus, emerging viruses that may go undetected because of a lack of severe disease in healthy people can pose significant risk to vulnerable populations with underlying medical conditions. Now, more on an epi scale, the lack of severe disease manifestations affects our ability to contain the spread of the virus. Identification of chains of transmission and subsequent contact tracing are much more complicated if many infected people remain asymptomatic or mildly symptomatic. More pathogenic viruses that transmit well between humans can generally be contained effectively through syndromes, right? Syndromic surveillance, like checking for fever and contact tracing. Although containment of the ongoing Ebola virus outbreak in the DRC is complicated by violent conflict, all previous outbreaks were contained through identification of cases and tracing of contacts, despite the virus's efficient person-to-person transmission. They go on to say that we currently do not know where the 2019 novel coronavirus falls on the scale of human-to-human transmissibility, but it is safe to assume that it is this virus. If this virus transmits efficiently, its seemingly lower pathogenicity as compared to SARS, possibly combined with super spreader events in specific cases, could allow large-scale spread. In this manner, a virus that poses a low health threat on the individual level can pose a high risk on the population level, with the potential to cause disruptions of global public health systems and economic losses. This possibility warrants the current aggressive response aimed at tracing and diagnosing every infected patient and thereby breaking the transmission chain of the novel coronavirus. So anyway, I just found that pretty interesting, kind of enlightening. And what I'm going to do is I'm going to go ahead and post a link to the actual study, or the perspective, and you can check it out for yourself. It's a good read, and let me know what you think about that. Okay, let me go ahead and continue on. We see that there's also some concern in Japan, right? What's coming up this summer in Japan? Right, yeah, the Olympics. So this outbreak in China is really, and there's some concerns of a pandemic, a global pandemic. So it's really forcing Japan to really take a look at this and how it could disrupt the Olympics and what kind of preparations they have to take. Now, Japan's seen 2 cases so far, but I would imagine that might grow. And the president of the Japanese Association for Infectious Diseases said Wednesday, we have to be very careful about what kind of infectious diseases will appear at the Tokyo Olympics. At these kinds of mass gatherings, the risk increase that infectious diseases and resistant bacteria can be carried in. Countermeasures against infectious diseases constitute an important part of our plan to host a safe and secure games in Tokyo. So, yeah, if I was working on the Tokyo Games, there would be a lot of concern, right? That's a big issue. So we'll be keeping an eye on that and how things pan out in Japan. Next thing I want to comment on is this study that came out of China, some Chinese researchers, and I saw it. I saw the press release on Eureka Alert, and it was about the coronavirus and their theory, which is came from snakes, and it looked a little sketchy. So I didn't publish it. I just didn't buy into it as hard as some did. Some published it pretty rapidly, but I couldn't. But I'm glad I waited, because there's a lot of people that are coming out today or during the days after this was published and are really questioning it. And the paper was published by Chinese researchers in the Journal of Medical Virology, and it claims to have used the viral sequence to find the most likely source of the emerging outbreak. And they say it's snakes. And of course, this press release was widely syndicated. And so this really spread through social media and all that. But there's a lot of researchers that say it's probably not true, right? There's a guy named Edward Holmes. He's a zoologist at the University of Sydney. He says it's complete garbage. So he says, let me see. And there's other people from North Carolina, other experts saying, this is not likely. It's always been from either mammals or birds. So anyway, you can check out the study for yourself and determine what you think. But there's a lot of people out there that came out soon after and said that's probably not the case. Here's a guy from Yale. He says, his name is Nathan Grubaugh, an epidemiologist up at Yale. And he says, I'm not saying it can't happen. It could. Nature does weird things. But again, the likelihood, he said, is very, very limited that this is actually a possibility. And then there's other reports saying that, yeah, this is probably not, I don't know. I mean, I like to just hear what you think, because at first glance, when I saw it, I was very skeptical about it. So I refused to publish it. And I feel like that was the wise move. Maybe it's true, though. I don't know. A couple more things. I don't know if you remember back during, I want to say it was the West Africa Ebola outbreak. Gilead, the drug company, made a drug, and it's called Remdesivir. And I believe this is the drug that they created for Ebola and Marburg. But during the DRC outbreak, the Ebola outbreak, the Democratic Republic of the Congo says it's really not that effective, and they chose a different drug to use. Well, right now that some clinicians and experts are looking at this drug, this antiviral, let me see if I pronounce it right, Remdesivir. This may be an option for people infected with the novel coronavirus. So we'll be keeping an eye on that and see where that goes. I think this drug has been used for some other respiratory diseases like RSV, maybe MERS too. But right now they're taking a look at it as a possible antiviral to use in this situation with the novel coronavirus coming out of China. And lastly, the vaccines. There's several vaccine companies that are already cranking things up and looking at something for the novel coronavirus, something that doesn't even have a name yet, like SARS or MERS, right? Because they still don't even know what the reservoir host is. But I saw the University of Texas in Galveston, they're working on a vaccine. The company Novavax, they're looking at working on a vaccine. So yeah, things are moving pretty rapidly, and it's really hard to do these updates because things are just changing, and everything I'm saying is going to be irrelevant in 10 minutes from now. But I mean, there's not a whole lot else you can do about it. And the other thing about this is it's making it very difficult as a website owner to cover other types of things that are going on around the world, because this is just like dominating everything. So there's other stuff going on. So, I mean, check out the website, outbreaknewstoday.com. We got a big dengue outbreak in Paraguay, right? Where even the president of the country has contracted dengue, right? So that's going on. We saw that interesting study about Marburg virus, where they have detected it in bats in Sierra Leone. This is the first time that deadly virus, right? Marburg, a sister of Ebola, the first time that's been detected in West Africa. So that's a big story. So there's a lot of stuff going on, but there's no doubt that coronavirus is dominating the airwaves. I'm even seeing this a lot on regular television shows, which is pretty odd because they barely touched like on the Ebola outbreak to any significant extent. So it's a good thing that they're touching on it. Oh, that's another thing. Like the Ebola outbreak in DRC, they haven't seen a case in 3 days. That's news, right? I think that's news. That's good news. But anyway, I'm going to go ahead and wrap it up. I appreciate you guys watching. And I'll see you next Saturday for a next Facebook Live on infectious disease news. All right. Have a great day.